Tennis elbow. Tennis elbow is called lateral epicondylitis. Tennis elbow is an overuse injury that causes inflammation, tendinosis, and lateral elbow pain at the origin of a small muscle called the extensor carpi radialis brevis. This is the location of the pain on the outer side of the elbow. The pain may interfere with sleep and activities, or even carrying groceries. When this muscle is overloaded by repetitive activities, it causes pain in the outer side of the elbow. I'm going to go into some details about this condition. It is the most common cause of elbow pain. 50% of tennis players develop tennis elbow due to many technical reasons and risk factors such as incorrect grip size, poor swing technique. This condition also affects workers doing heavy lifting or repetitive gripping or using heavy tools. The pathology of the tendon shows disorganized collagen and angiofibroblastic hyperplasia. The condition usually starts by micro tears of the origin of the extensor carpi radialis brevis due to eccentric overload, which is precipitated and aggravated by repetitive wrist extension and forearm pronation. So the patient with tennis elbow will complain of pain with gripping, decreased grip strength, pain with repetitive wrist extension. Patient will have tenderness around the lateral elbow. Here is the pain of tennis elbow, and here is the pain for the radial tunnel syndrome. The radial tunnel syndrome should be in the differential diagnosis of tennis elbow, especially if the patient is not recovering as expected from tennis elbow treatment. You got to suspect the patient have a radial tunnel syndrome. The radial tunnel syndrome gives pain about 3-4 centimeter distal and anterior to the lateral epicondyle. Radial tunnel syndrome occurs in about 5% of the patients due to compression of the posterior interosseous nerve. Also, you need to rule out cervical disc and triceps tendinitis. Basically, the diagnosis of tennis elbow is based on the symptoms and physical examination. The provocative test, which will increase the pain at the lateral epicondyle, is resistant wrist extension with the elbow fully extended. You can get x-rays of the elbow, but the x-rays is basically normal, and rarely you may find some calcification. The treatment is usually activity modification, non-steroidal anti-inflammatory medication, physiotherapy, especially eccentric exercises. Injections are frequently used. Injection can be steroid injection or maybe PRP injection. The ultrasound guidance may be helpful in the injection. And bracing. There is 95% success rate with non-operative treatment to relieve the pain, which may take up till 6 to 12 months to improve the condition. Surgery is the last resort for release and debridement of the extensor carpi radialis brevis origin. Excessive debridement and release of the tendon can lead to injury of the lateral collateral ligament, and that may lead to posterolateral rotatory instability of the elbow. Thank you very much. I hope that was helpful.